Hello and welcome to another Tuesday Talk with Ruby Reese. My name is Killian. I'm co-founder at Ruby Reese and at dognutrition.ie. And I'm also going to be your podcast host. This week, we're going to be speaking about a topic that may be triggering for some listeners. It may also just not be the right time for people to listen to it. So we will be dealing with quite complex themes, quite emotional themes such as euthanasia and supporting those going through pet loss grief. So if this is not your episode or not the right time for this episode for you, please feel free to give this one a skip. But I'm really, really delighted that I have two brilliant guests joining me on the podcast, both of whom work with this area quite a lot and have together developed a course as well in this whole area of supporting those going through pet loss grief and to euthanasia, dealing with euthanasia in a respectful way. And it's absolutely fantastic the work that Louise Griffey from Light After Loss and Dr. Megan Anderson from Rainbow Bridge Vets do in their day-to-day business. So without further ado, I'm now going to let you listen in to the chat that I had with Louise and Megan. Megan, Louise, welcome back to the podcast. How are you both doing?
Great, thanks, Killian. How are you?
Very good, thank you. Would you mind doing us the pleasure of introducing yourselves for anyone that doesn't know you yet?
Perfect. My name is Louise Griffey and I'm the founder of Light After Loss. So I offer support for people going through pet loss or anticipating pet loss, and I offer a range of supports all listed on my website. But yeah, that's my story.
Thank you very much, Louise, and welcome back.
Thanks.
And a new face to the podcast. Welcome, Megan.
Thank you. Thanks for having me on. So I'm a vet qualified just over 10 years now, and about a year ago I started the first palliative hospice and end of life service for pets in Ireland. So end of life, pet owners' relationships with their pets, care for the pets themselves, and the whole process, from knowing that, end of life is approaching right up until the moment is kind of an area that I've a really strong interest in. I'm trying to improve the support I think that we offer and the experience that we offer for pet owners in that situation.
That's amazing. Thank you so much. And like I say, both of you are very, very welcome back to the podcast. And it's amazing the work that you're doing. And I really can't wait to dig into the work that you do. So I suppose a really good place to start is, what actually first drew each of you to focus your work on pet euthanasia and grief support?
So for me, I guess it came from my own personal experience of losing both of my dogs, Ozzy and Moose. And I know I spoke about that with you on the podcast before, Killian, but for anyone that hasn't heard it, I suppose their deaths really broke me in a way that I hadn't ever experienced before. And I struggled with deep grief for several years and guilt and the trauma around how they died and everything. So I suppose I realised during that time that there was very little support specifically for pet loss because I went looking for it. And I just realised how it's so painful for people and it's so all-consuming and you just can't escape that kind of emotional pain. So it led me to do my own healing work around it. And then now I've trained and support others so I could help them feel less alone in something that's incredibly isolating.
Yeah. And I think last time you mentioned as well, how other people kind of see pet grief as well. We discussed that kind of at length. I think, it's really, really difficult to get understanding, I think, from others sometimes, depending on your family group, your friend group, your colleagues, etc., your social support network. Sometimes people get it and sometimes people don't. So totally respect everything that you're doing and an amazing journey that you've been on. And Megan, how did you get involved in this area of work?
So I suppose a little bit like Louise, I have a dog to thank. when my mother-in-law was quite ill a few years ago. She ended up in hospital, and um, I ended up with Pip, her little dog. And to be honest, we hadn't seen him in quite a long time. And when he finally came to us, he was really not in a good way.
Mm-hmm.
He was really very ill, very poorly controlled diabetes, very bad dementia, on no treatment for quite severe arthritis, quite a lot going on. And just with everything going on with the family at the time, I was kind of making no promises, but doing my best to try and saved the family from two goodbyes in a very short period of time. And he actually did so well with just palliative care. None of these were conditions that were going to be cured or fixed. But just managed good pain relief, treating his dementia, some supports at home, and I just couldn't believe how well he did. I was shocked. And that was Christmas 2 years ago. We actually just said goodbye to him this Christmas past, and like I couldn't get over how much of a difference it made. But it also gave me a totally new perspective on what pet owners go through with chronically ill pets, and what we ask of them, what we ask them to understand, what we ask them to emotionally process, what we ask them to physically do, what we ask them to financially manage. And it just gave me a whole new perspective on what we're not providing for these pets and for their families. And that was me, a 10 years qualified vet, managing my own dog with, years of experience, education, qualifications, access to drugs, a level of confidence and a whole load of resources that pet owners don't have. And I just saw this gap that was there, both for the patients and their families. And I just thought we could do better. And these services, they exist in other countries, but nobody was doing it here. So I just really wanted to give it a go and see if it was something that we could offer as a resource for families that wanted it. And then to be able to provide that at-home care when it came to actually saying goodbye, when the time of euthanasia came, because that's something, again, between veterinary world becoming more corporate, practices in more urban areas, it's really, really difficult for them, to spare clinicians to be able to take, hour, 2 hours to just give families the time at home that they need and give their pets as good and peaceful and comfortable a final moment as we can give them. And the capacity, I just felt, wasn't there. And I just think it's really such an important thing and so undervalued in terms of how it affects families for days, weeks, months, years after they've said goodbye. And I just thought we could do better. So I'm trying to do better.
And I think that's something we see right across the Irish pet community and dog community. When we all need, I think, to kind of level up a little bit on so many different areas. We see this, it's not just this one singular area, and it's certainly not, it's not isolated to veterinary, it's not isolated to grief, it's not isolated to nutrition, training, behavior. There's so many ways that our community should, and I think is, stepping up as well. And so it's amazing to see that, I suppose, both of your very personal experiences, led you down this path. I think you probably have to have been touched by it personally, don't you, to kind of say, I'm brave enough or I see the need enough to help people with this. I don't think anyone really stumbles into this kind of work. And I suppose, talking about it, I know we often smile, we often look upset, but I think, Louise, I know we've spoken about it in the past. There's no correct reaction for talking about death or grief or situations, and I think it's sometimes we're smiling out of embarrassment, sometimes we're smiling out of, so I think it's important to mention that as well as we're kind of going through this topic in particular, that all three of us might have different facial expressions and we might be feeling a very similar thing. It's just that, it kind of works that way.
Absolutely.
So you amazing people came together from two kind of separate areas with very good intentions. Your paths crossed. How did your paths cross, and how did you end up creating a course together, or co-creating a course on gentle euthanasia and supporting grieving pet owners?
Well, I guess I was always annoying Megan to come onto my podcast and share some really valuable information with my listeners who are going through pet loss or anticipating pet loss, and about, end of life care and hospice and everything. It's just so invaluable for people. So I think it's just, I guess it kind of was born from having those conversations either before we hit record or after. And we would just sit there and go, why isn't there something out there for the veterinary community so they can best support the end of life appointments and euthanasia appointments? Because and Megan will tell you, there's very little in the college course. Like, there's just so little in university that they train vets on this particular topic, and even just how to word things and just how to support someone even in a basic way. So it just doesn't exist. So that's why we just wanted to do this, and coming from like my mindset of supporting people through grief, and then Megan's expertise with veterinary and how she can help vets kind of navigate that herself. I think it just kind of came from that, Megan, didn't it? It was just like it was a natural thing.
Yeah, it was just, I think we both saw where there were gaps, both in kind of the veterinary service, but also just the continuity, the recognition that, when a pet is put to sleep, it's not just, okay, here's an injection, your dog has passed away, see you when you get the next one, and unfortunately that has been, and in some places still is, kind of the approach. And I think we both just saw that there was this kind of gap, this empty space where people were just getting abandoned, really, between the euthanasia experience itself and then, this huge part of their lives that's just suddenly gone, even if they knew it was coming. I think, the service that Louise offers is just fantastic, because it's a big part of palliative and hospice care in the veterinary sector, is really family focused, person focused, human animal bond focused, and also support after a pet has passed away, and to find somebody who is really focused, that I can say to my clients, especially the ones that I know are really struggling, to be able to say to them, here's a person who's gonna get it. This isn't a random counselling session down the road who may or may not be a dog person, may or may not be a cat person. This is someone who really understands the relationship that you've had with your pet, the importance that they've had in your lives, and who can support you through that, so that they're not just abandoned. Okay, your pet has passed away, that's us done. That there's more to it than that, especially for the family, and here's a resource to support you in that. I think that's so important. And it just is so nice to have somebody like Louise who just really understands how the two interconnect, because what we do is an extension of the same thing. Yes, mine's a little bit more technical, medical, but what Louise does, I couldn't do. She, like, the skill, the understanding, the connection with people to be able to help them through something so difficult. And it's just so nice to be able to have that to offer them. And then, in that, realising how well our two services really connect. And then, as Louise said, just getting chatting and realising, actually, why is everybody not doing this? And so here we are. trying to get more people to do things like this, because it's just, it's so important.
Yeah, absolutely. Like, I suppose in fairness to vets, we kind of expect them to be everything to our dogs. You know, it's your, in the human world, it's your dentist, it's your general practitioner, it's literally everything, you know, and on top of that, probably psychologist, and a lot of people think trainer, behaviorist, nutritionist, etc., etc., etc. So, you know, we kind of do a lot of you know, we put a lot of focus on our vets, and they carry a lot of responsibility. So I love the fact that you're here kind of supporting that community as well. Okay, so when we're speaking, you know, about the support network, then, you know, how can people start to grasp? And I know you've got a whole course on this, which we'll obviously link into the show notes, as well as your podcast, Louise. But, you know, many people are thinking, where do I even start? So how can we support people going through pet loss, you know, as grief counsellors, as family members, as colleagues, and also obviously as veterinary professionals? How do we begin to support people, particularly in and around, I suppose, that guilt that we were talking about earlier?
I think just helping to validate people really in the guilt that they're feeling, and just helping them to feel seen and heard, really. And just, there's so many ways that people can support, but like, even when we're talking about this context of end of life and euthanasia, it's just super important that people are just like educated around this topic. I think that's the main thing. And then, like, it's all well and good that people think that they're going to say something and they're like, I know how you feel. And even that sentence can be taken like, how do they know how I feel? Like, this is a unique experience, and they might know like it's a similar experience, but may not know exactly. So, like, my number one tip anyway is, even if I'm speaking to the veterinary staff, is just to be a little more gentle with their wording, and really help people to feel validated and seen in that moment. And I know that people have busy lives and they have to rush to the next consult, or there's a queue behind them, or whatever that is. It's just so that somebody can feel seen and heard in that moment. And I think we'll talk a little bit later about maybe some wording that might be helpful. But Megan, I guess that's more your area then to come in on and tell us about it.
Yeah, I think it's really just meeting the client where they are,
Mm-hmm.
um, you know, and not assuming anything about what they're thinking or feeling. Ask them, and trying to support them in coming to decisions themselves, because, you know, as veterinary professionals, our number one responsibility is to advocate for our patients first and
Mm-hmm.
foremost. But that doesn't mean that we need to do that in a way that exacerbates the pain that a client
Yeah.
is feeling. And just taking things at their pace in terms of having the conversations around end of life, about what's happening with their pet, talking them through what you're concerned about, and allowing them to come to a conclusion themselves, because they're the ones that have to live with the decision that they're making. And, you know, one of the really common things I hear from clients is, you know, the vet told me my cat has a few days. My dog has a terminal diagnosis and I have to come back on Monday to put him to sleep. And it's put to them as, this is what's happening. It's not an
Mm-hmm.
option. It's not a conversation. This is the diagnosis. Therefore, this is the end result. We'll see you for that appointment. And the client then isn't included in that process. And that doesn't allow them to start the grieving process. And it doesn't help the appointment when the time comes for euthanasia. It doesn't help them come to the decision. They might not turn up for the appointment, even if it really needs to happen. And it just compromises everything from the client's experience, potentially the welfare of the pet, relationship they have with their veterinary practice. Everything suffers. So really
Mm-hmm.
just meeting them where they are and listening and supporting them in their decisions, so that
Yeah.
they can make them and live with them. But we don't
Yeah.
get, as Louise touched on earlier, as vets, we don't get any training on this, so it's quite a
Yeah.
difficult thing to do. But,
It's
that's
quite a
hopefully
big responsibility and a big kind of a big ask for those of you professionals that come across this probably every day. Your average vet comes across this, or that's at least my kind of understanding of the world anyway.
Yeah.
If you don't have any training in it, how can you be expected to always do right by everyone? And I'm not saying that's the expectation, but like you've both mentioned how individual grieving processes are. And I think, Louise, I know we spoke previously definitely about, there's no wrong way to feel or right way to feel. It's your process. There's no kind of model or kind of cookie cutter experience of grief, and it's not a 7-step process or whatever someone might like to tell you or fit into a 90-second TikTok.
Yeah.
And it's an individual one. So Megan, I love how you said asking people how they feel about things. It's we don't always, I don't know if the modern world has kind of taught us to listen as much as we should. I think sometimes talking is more promoted than listening, but it's so important if you want to understand other people to actually listen. And I suppose maybe some people might ask, will Irish people actually tell you? But it sounds to me, if it's your advice, that typically they will.
Yeah. If you ask the question in the right way, they will.
Yeah. Yeah, exactly. And I think people do want to be heard, particularly when it's around their emotions, or when it's going to be something really, really personal. As long as people feel that it's done with the right heart and with the right sentiment, I'm sure people do open up if they feel like it's kind of a safe space, I suppose, to do so. And talking about that emotional safety, so what does that kind of look like in a consultation room or at a home?
Well, I guess, like, from my side of it, it's kind of about making someone feel seen and heard, like I mentioned, but also not judged as well, I guess, because it's just trying to leave that judgment kind of outside. And in a consultation, kind of like that might mean like slowing things down more than the regular kind of consultation that might happen, and just using a calmer tone, a slower tone, making more eye contact than usual, like giving permission for all emotions to kind of enter that consult room and just being prepared for that, and like not rushing. I know it's kind of hard not to rush, and Megan will definitely say that, but when it is a consultation that's around end of life or euthanasia, then not being overly clinical like is super helpful as well. Allowing space for even silence, like just letting silence feel comfortable for everybody in the room, really. That might just look as simple as sitting with somebody and listening, like you just said, Killy, just the art of listening and trying not to fix and just learning how they feel. I think that's definitely the important things when it comes to creating that emotional safety for for the person that's going to be going through this, having to make a difficult decision. And then that's going to equally be helpful for the vet or the veterinary staff as well, I think.
Yeah, I
And
think there's a lot of really good points there. I think that slowing down is a huge one.
Mm.
There's really I think any pet owner going into a busy clinic, I think once they're aware that there's an end of life conversation happening, they, they'll give the time. They understand that there might be a bit of delay because they know eventually it could be their turn. And some people in the consult room feel that they're holding you up, that they need to rush through things, and just giving them the reassurance that there is no rush. I'm here now for you, for your pet.
Mm.
And right now, this is the most important thing, and everything else can wait. And I don't have anywhere more important to be other than right here at this moment. And sometimes that's all people need, is to have that reassurance and that it's okay to slow down, to be upset, whatever it is that they need to be. And then they kind of, everybody in their own way, they tell you what they need. Some people need to tell jokes and tell stories. Some people need to cry their eyes out. Some people need to sit in silence. Some people need to talk about absolutely anything other than their pet. but they lead the way, and all you do is just follow their lead. The most important thing, I think, is giving them that reassurance that you're supporting them in their
Hmm.
decision, and that you don't have anywhere better to be at that moment than right there. And that's it. That's the hard
Yeah,
part of
and
it.
that is, it sounds like it's the hard part of it for sure. And I guess that ties really well in with my next question as well on, the use of language. So, slowing things down, letting people know that there's time that can be created or time that can be taken
Mhm.
up to kind of fully process this unfortunate event, I suppose, or usually very sad event in someone's life. But and reassurance as well, I think is something you mentioned as really important. So is this kind of something that's helpful? And then is there, I'm guessing, the opposite of that language then, kind of rushed and very, let's say, maybe too clinical language might potentially be harmful when speaking with someone going through pet loss?
I think there's so much about the language, and I guess, and it's so hard for people to know what to say, and I can so empathize with that, because when I started my work, I had to learn about correct language to use that isn't going to cause any more emotional pain than what the person's already going through. So, like, and I don't really have to, I know I've said this before, but I know people listening, it'll be alien to them because they're animal people. So, things like, you can get another dog, or even, sure, don't you have another pet at home, and you can focus on that, and kind of dismissive kind of comments like that, or haven't they lived a long life? You gave him a long life. So, it doesn't necessarily sound that painful on the surface, but it can kind of wound somebody deeply in their heart. So
Hmm.
it's just trying to think before the words come out, or even just like in the course we go through a big section on this in the webinar. Sorry, I might say we go through lots of examples, don't we, Megan? We kind of have it all laid out in lots of examples and scenarios of how this might come across in our sound in the consult room, and what's harmful and kind of what's helpful and that kind of thing. So,
Yeah.
like, just saying things that are kind of matter of fact, like, this is incredibly hard. Like, it's okay to feel the way you're feeling. Like, it's just validating them, saying that it's okay that you're crying, or even if somebody isn't getting upset, that's okay as well. So it's just, there's definitely loads and loads in the webinar that we go through, but that's just like touching on it. And like you say, just we are trying to avoid that overly clinical language. And
Hmm.
Megan, you'll probably touch on that. You probably know more than me now in that aspect in the consult room.
Do you know what? Actually, since we really went through some of the specifics, I'm just listening to some of the, like, really good examples, that Louise has given. Like, actually, one of the things that's really surprised me since becoming just more specifically aware of some of that terminology and some of the phrasing, things like, oh, well, at least he lived a long life, and phrases like that kind of minimize what a person is going through. But actually, so many pet owners say these things themselves in the moment. It's they're they almost feel guilty for feeling sad, or they feel silly or ashamed or embarrassed, and they're saying these things themselves about their own grief and their own sadness. That's perfectly understandable and justified. And I've started telling people now, like, you absolutely don't have to apologize. You have nothing to apologize for. And yes, he lived a very long life, and that's wonderful, but it's never long enough. My dog was 17. That wasn't long enough. I needed another 17 years. These things, we do it to ourselves as pet owners, let alone needing someone else in the room saying these things. And it just, actually, when I correct people on their own minimization of their own grief, actually you can see them sometimes think about it and go, yeah, that's really true. I 17 years is not enough. And no matter how long he lived, it wouldn't be long enough because this dog is so important to me. He's such a part of my life. And I think it's something that just as a modern society, we could all do with better education on how to handle these things and better awareness. Because it's really common things like that. And then on top of that, you know, you put in the technicalities in a clinical context, talking about, you know, catheters and, you know, changes, post-mortem changes and the dying process and all of these things. And then at the end of all of that, when someone is completely overwhelmed and upset and feeling embarrassed about their own grief, and then somebody else comes in and minimizes it, like we can do so much better. And I think it's something, as I said, I think being able to have somebody like Louise in that context to be able to say, here's somebody who is not going to minimize your grief, who understands, who knows what you're going through and believes that you have the right to be supported through that and recognized through that. And if we can sit there as vets at the end of that appointment and say, here is somebody who knows what you're going through, who can help you through it, and it is perfectly okay for you to go reach out and speak to that person, and that's not unusual or abnormal. It doesn't make you weak. It's something that is healthy and okay. And if we can normalize that, I think if we can spread that through pet owners, veterinary clinics, that's, I think, well, speak for myself, I suppose, but that would be my goal, I think, is to give people that resource. And I think Louise would be the same.
Yeah, definitely an aligned goal there.
Yeah, definitely. And it's you know, it was interesting the way you said as well, you know, of course your pet's life is never going to be long enough. I think if anyone listening into this podcast, I know our audience really, really well. So they care deeply about animals. They care about their own animals. They care about caring for other people's pets, and it's, you know, it's something that's so dear, definitely for us. You know, it's going to leave a hole in your life, in your routine, in your day-to-day, for sure, regardless of whether your dog, you know, is, like you say, 17 or 36. You know, when they do finally pass, it's always going to be too early if you deeply care about them and that relationship. It's always going to leave a hole. We interrupt this podcast episode to let you know about a course that we've spent quite a lot of time putting together. It's all about nutrition, dog nutrition for pet professionals. There are no prerequisites for people to take part. We've created it up to a level that is going to be really interesting for lots of the listeners of this podcast. If you'd like to find out a little bit more about it, you can head on over to the Ruby Reese website, or you can find a direct link below in the show notes. And I think, Louise, we spoke about it briefly as well last time, you know, talking about maybe, you know, body care and, you know, creating memories for a past pet. Does this make a significant part of the grieving process for some people, at least? Like, we know it's an individual process, but for some people, can it be helpful to, you know, to create memories and ways of remembering your pets?
I mean, it so can. And I think especially some clients I work with that are anticipating the loss, or, you know, their pets are going through a terminal diagnosis. And if I mention Megan's service, Megan can help people prepare for that and give them ideas as well on how to create memories prior, and all within their pets', you know, needs and capabilities at that time of their life. There's that, but obviously there's situations where we don't get time to prepare prior to that. So like memorialisation afterwards is the options, and lots of veterinary clinics have lots of different options available regarding body care and how they'd like, you know, to discuss that with you. So it's that two-way conversation of, don't be afraid to bring that up in conversation with your vet and our veterinary staff that are there, and that can really help people to like grieve well from the beginning, to have that kind of, I know like grief is completely heartbreaking, but making those small choices even prior to the euthanasia appointment can make a huge difference in how the grieving process begins for somebody. And it just means that it's helping them find like a new way to kind of hold on to that bond in the way that they want that their pet, in different ways to memorialize them. And I think it's like there's so many different ways. There's the paw prints, there's the clay prints, there's the clippings of the fur, there's jewellery that you can make, resin jewellery.
You can even have diamonds grown out of the carbon of your pet's ashes.
Yes, that's incredible, isn't it?
Yeah.
Yeah, so there's loads of different ways, and I know Megan probably gets all of the ideas through to her, sent to her clinic from all different kinds of companies. So share with us, Megan, if there's any more. I've just touched on the basic.
There's loads of different ways. I think it's really important to acknowledge as well that everybody is different. A really common question I get asked is, what do other people do? And I think it's really important to say it doesn't matter what other people do. Everybody does something different. Some people don't want their pet's ashes back because they find that too difficult. And they don't want paw prints and they don't want fur clippings because to them, their pet is gone now. And any of the memorialisation options it just feels painful and a reminder of something painful. I think it's equally important in those moments if somebody knows that they don't want these things, that they don't feel judged for that. And then you'll also get the people at the complete other end who want absolutely everything. Where everybody, including the dog walker, wants a fur clipping and some paw prints, and that's absolutely fine. Some people scatter the ashes, and I have a few clients who planted roses where they've scattered their pet's ashes as a memorial, or planted a tree. So you can have jewellery made. There are companies that will do jewellery for men, cufflinks, things like that. People that have photos of their pet's paws turned into 3D prints. So there's no end of things that you can do. And I think it's just reassuring people that, if they want to have their pet taxidermied, I've had plenty of queries about that as well. That's okay. It's up to them. It's whatever helps them through that process of grief, that they feel okay, coming through it, whatever helps them. But there's so many options. Some of them more available maybe than others. The paw prints and the fur clippings are certainly the most common, but there's all sorts of really lovely ways that people memorialize their pets.
Yeah. I'm kind of the type of person, I don't know if I'd love, a diamond pressed with ashes, or I don't know, it's just potentially not me. But and like when I'm kind of thinking about this topic, it's funny because, like usually I think like what I probably treasured the most to be like photographs from when they were, throughout their lives. But I'm actually the world's worst person for taking photographs at important milestones as well. Like, I'm that person that goes on holidays and comes back with like one photo, and so I should probably like ingrain that into my processes as well. Like while going through life, as soon as I appreciate looking back on photos, maybe think about doing that. And it's probably the same. If people are going to appreciate something, they should probably think about it. During good times as well.
I can resonate, because when my dogs died and I had like my phone, and it was 6 years ago, so I had an older phone, and I had a good few photos, but I hardly any videos, and I was like, I would have absolutely loved loads of videos just to see remember their movements and their just quirks. And the fact that I didn't have many, I was like nearly kicking myself over it. But I know everyone's different. They live in the moment, and maybe that was a good thing. Maybe I was living in the moment with them and just didn't have the phone in the hand. So, there's a kind of balancing act where you have to think, will I just spend all this like quality time with them and be present, or will I just have the phone out? So there has to be like a balance, I think. But yeah, I totally get you where you're coming from.
Sometimes people might feel like really overwhelmed by grief as well, and I'm sure it creeps up on people differently. And like you say, we can't reiterate enough that it's a very individual experience. So when grief feels overwhelming, what kind of supports should pet owners, grieving pet owners, be kind of guided towards, and what could be suggested for people that are going through grief?
Well, I guess if the end of their pet's life happens within the clinic, the veterinary clinic,
Mm,
there are definitely lots of things that can be kind of suggested, but timing is a thing here to kind of discuss as well. There's a certain time and a place for that, and it may be a couple of days after, it may be that they ask straight away after, and Megan probably has experienced all kinds of different scenarios for this, and some people may not even want support. They want to kind of go through this their own unique way, and they may not. So it's not kind of about pushing anything on somebody, but feeling stuck in that kind of intense guilt or trauma, it's really important to then suggest support. And this could be like a pet loss support service like my own. It could be a book. It could be professional therapy, counselling, support groups, helplines, for example. But it's just offering it gently and kind of not forcing it. It could be giving people a leaflet or pointing them towards. It could be an email even afterwards. It can happen, or a gentle phone call maybe a day or two afterwards, just to check in on the person, and so that they know that although the care for their pet has ended, that the care that the clinic have for the person that had the pet, like the person that was the parent, basically hasn't ended, and that the clinic do care about them. And also for somebody to feel empowered, if they do feel empowered enough to ring the clinic and ask for that support and say, do you offer anything like this? Do you know anything? And maybe that clinic can point them gently in the direction. So definitely, but some people aren't, in
hmm
Ireland, in that mindset of just, let's just get on with it, and let's not talk about our grief is so prevalent. So I'm sure Megan can touch on this as well from her perspective.
Yeah, I think like what I do generally in terms of, just giving people access and trying to normalize the concept of support for this particular type of grief. I always leave, at the end of any euthanasia appointment, I leave them one of Louise's leaflets and just, a brief comment on, this is just a bereavement support service. Louise is, pet bereavement is what she does. And so you don't need to worry about somebody on the other end of the phone. Are they going to understand? Louise is going to
hmm
understand. And it's here if you need it. And I just kind of leave it there. And,
Yeah.
if they're kind of looking at me like, "Oh, I don't know about this. This is a bit strange. Never heard of this before." I might say, look, you can do whatever you'd like. You can put it in a drawer and you may never look at it again. But it's there just in case you do.
hmm
I would include a leaflet when I'm seeing palliative or hospice patients for the first time. I leave them a little packet of just information, resources, things about aftercare options, cremation, body donation, and then what to expect during a euthanasia appointment, and about a little bit about bereavement.
hmm
There's a really useful Blue Cross leaflet that has some information about pet loss, and particularly around other pets, around children, and one of Louise's leaflets as well, so that it's there before they're really in the throes of really intense grief. But they might be experiencing anticipatory grief when they know that this is something they're going to have to deal with soon, and they know that they're going to have to face the loss of their pet. Some people feel that really, really intensely. They
hmm
don't know how to name it and they don't know how to talk about it. But if they see that there's a support there that they don't have to wait to reach out to,
hmm
or at least it's an avenue that they can try. And then I would, follow every euthanasia appointment with an email. Again, just 2 sentences at the end of it, expressing condolences, but also just, if you're experiencing this, if you're struggling with grief, if you're struggling with, you know, processing what's happened, here's somebody to talk to if you need it.
hmm
And it's not pushy, it's just, here's a resource.
Yeah.
And some people I really wish would, because I think some people could really, really benefit from it, but you can't make them. You can't force it. It has to be their decision.
Yeah, definitely. And I think, even knowing that there's support there, well, when the right time comes, that it's there and know who to call, but also, I think even knowing that there's support out there can be a relief to a lot of people, to
Yeah.
know that, they're not alone in this feeling. They're not a weirdo that grieves over pets, that they're not isolated and the only person on this earth that's ever made a relationship bond with a non-human.
Exactly.
It's like it's so important. And I must say, particularly on episodes that we've spoken about this before, Louise, on the podcast, I regularly at big public dog events have people approach me, people that I know, people that I don't know, approach me and say, I listened to one of your podcast episodes. It really, really helped me. Thank you. And they walk away, and they don't want to talk about it. I'm not the person that they want to talk to, but it makes such a difference. Even just this conversation, chatting about it, I know is going to help people out there, because I'm sure
Yes.
lots of listeners will feel seen, whether they're grieving themselves or whether, that they're professionals working with, the guardians of patients that are being euthanized or have recently passed. It's so important just to know that you're not alone and there are resources out there. It's a huge burden on the veterinary community. Honestly, I've said it before in this podcast and I'll say it again. We expect you guys to be an awful lot of things and to wear an awful lot of hats. So it's
so
incredible that and that you've put together this course. I think is phenomenal. So I think a lot of people working in the veterinary community could really, really benefit from it and feel like they have maybe more tools to offer people. I'm guessing that was your major aim, right? Is to give people the professionals the tools
Yeah.
that they can then pass on.
Yeah. And like it just really hit me. God, it would have been a few months ago. But probably just before Christmas, and I had a vet student seeing practice with me, and she was, nearly finished. She was almost done, almost qualified, a few more months to go. And I asked her, I had a euthanasia appointment as my last appointment of the day in the clinic, which is very understanding. I wouldn't generally bring students into those appointments. It's just a little bit intrusive for the pet owner. And I just personally, I feel it's not really appropriate in most cases. But I just kind of took the opportunity and just said, look, have you had much training? What have they gone through with you? What is college? What have your lecturers covered? Are you familiar with sedation and catheters and how to have conversations and consent? Nothing. And like to give some credit, the university courses are definitely improving when it comes to what we call soft skills, interpersonal skills, having conversations with owners rather than just throwing out our opinion and sending them on their way, trying to really engage better and a more holistic, comprehensive approach. But the euthanasia side just doesn't seem to have made it in there. And I was so shocked that, in the years since I've qualified, that still hasn't in any meaningful way come into the course. Like, I'll be honest, the first euthanasia I performed, I asked the boss at the time, how do I exactly go about this? And he went, there's the bottle, there's a needle and syringe, go find a vein. That was
Okay.
kind of it,
Yeah.
and that was my training, as a newly qualified vet. And it sounds like, there's not a huge amount of progress on that. And I just thought that is a gap we need to fill. That's really scary, if you're
Yeah.
a new qualified vet, newly qualified nurse, even a support staff coming into a clinic never having experienced this. It's a big thing. There's a lot of emotion and there's a lot of ways that you can get it wrong. And I just thought it was really important that we offer some sort of accessible resource for the veterinary community in particular. Kind of, there are definitely ways to do this that are better than others.
Yeah,
And here's a better way. Um,
absolutely.
so there we go.
Uh,
Hopefully people
That's
find it useful.
Yeah.
Yeah, and I honestly think that people will find it useful because it's so important that we talk about this. I think it's an amazing time. Like earlier I mentioned, I think lots of people in the dog community are stepping up their skill base, stepping up their knowledge,
Definitely.
hopefully their emotional intelligence as well. And I'm not saying that they're not. It's just, it's like a muscle that needs to be flexed. And I think the more you know, the more you can kind of apply it better. And
Yeah.
I'm really, really thankful for both of you for coming on and chatting about this obviously difficult topic. I mean, guilt in and around euthanasia and grief is just such a hugely difficult topic for all of us to process, to speak about, kind of work with. So thank you so much for coming on. Thank you so much as well for creating this course that's down in, it's linked in the show notes. And I think we'll have to get back on and chat about this again very soon.
Love that.
Definitely. So much more to talk about, but thank you so much for having us, Killian. It was lovely.
Yes, thank you so much.
Thank you very much, and keep doing the amazing work that you're doing.
You.
You too.
Thank you. And once again, a huge thank you to Megan and Louise for coming on and chatting with us this week about a particularly difficult yet super important topic. If you'd like to find out a little bit more about Louise Griffey and Light After Loss, Dr. Megan Anderson and Rainbow Bridge Vets, or indeed their joint course on this very topic, you can find all of the links and details in the show notes. There you will also find details. You can find out a little bit more about Ruby Reese and dognutrition.ie. Thank you very much for listening in. You are so valued as a listener, and we look forward to being back with you again in just a fortnight with another topic.